And one of the people that I know agrees with me is the senator from South Carolina, Jim DeMint, on the line here. Good morning, Senator.
Hey, John, good morning.
Yeah, good to talk with you again. In this environment of transparency and openness, the House decides they're going to pass the bill Saturday night in the middle of the night.
Well, that's the way they can hotbox their members. They keep them here until they get the votes that they need to pass it. And the Republicans tried to do that a few times, too. It's not a good way to do business, but sometimes it works. The Senate, we've got a different situation, and what we need to be afraid of there, John, is they may pass something that's much more benign, that doesn't have a government-run plan in it, and they say they fixed it. The problem is that bill will meet Nancy Pelosi in a conference where they really rewrite the whole bill. We can't let anything pass in the Senate, otherwise we're going to create a monster.
No, this thing's got to die, and it's got to dry up and blow away. I've been predicting for a long time that it will, because it's just way too onerous. I am happy to see this morning, I'm not sure how happy I should be, but I'm happy to see that there's some people that are raising their hands on this cost of all of this, and the fact that it's being billed as containing costs and making things more affordable, when the reality is just the opposite.
Right, and it's certainly not insuring anywhere near the number of people they said it would insure. And the ones it is insuring, it's because they're threatening a lot of young people that you're going to be fined or go to jail if you don't buy a policy.
I can't believe that we even have that sentence, and that some people are actually buying it. If you don't buy health insurance, we're going to put you in jail.
Well, that's only if you don't pay the fine.
It's just amazing, isn't it, that we have come to that?
Well, I mean, we do have a problem we need to solve, but they've manufactured a national crisis with this thing. There are a lot of things we could do to make insurance more affordable and available, but they're not interested in those things. They want government-run health care, and anyone who thinks otherwise is very naive.
And they also wanted, I think because of the politics, the fact that it is the president's numero uno agenda item, and that, he's pushing hard on Reid and Pelosi, get it done or we're all in trouble.
Right, and he's going to use this as a momentum builder for a number of other things that people aren't noticing that are happening right now, John, that coming out of committee in the Senate. Barbara Boxer has got her cap-and-trade plan. The House has already passed their version. There's a regulation of the Internet movement going on, starting with the administration's FCC right now. They're going to unionize the airport security people. There's a lot of these things going on in committee that the public doesn't notice because we've got this big health care debate. But we're still spending money like it's going out of style, and the rest of the world is looking in on us and thinking, what are we doing? The value of the dollar is crashing, the debt is increasing. We need to put the brakes on this, and the place to do that is with health care.
You're absolutely right. What's your guess here? Will we be able to stop this thing in the Senate?
I think it's about 50-50 right now. There are only one or two on the Democrat side who might help us. Joe Lieberman is speaking up as he's not going to accept the government option, but we've got to be careful not to do what the pro-lifers did in the House. The pro-life Democrats said, okay, if you fix this, we'll vote for it, and then the Republicans went along and helped them pass the pro-life amendment. That helped them pass the bill. We've got to make sure we don't say that the whole game is the public option, and if they take it out in the Senate, then 5 or 10 Republicans jump on it and vote for it. There's a lot more wrong with this bill than just the government-run plan in it. All the mandates and requirements would totally change the insurance industry in a negative way. So it'll be a chess game, but I think we've got a better than 50-50 chance to stop this thing before Christmas.
I still do not understand for the life of me the explanation or the argument that is given that this is going to save money, and the way they're going to do it is by cutting fees to doctors and to hospitals. Medicaid is already underpaying what retail should be or what value should be. How do you cut that even further and have anybody do anything, provide any kind of service?
You can't, John. For years, I worked in healthcare as a consultant in a lot of rural areas in South Carolina, and you couldn't get a doctor to practice once over 60% of their patients were Medicaid, Medicare, and that happens in a lot of places. We're not going to have doctors if we've got a government plan. There's just no question about it. Already, fewer are going into medical school, and a number are planning to retire early because so many of their patients are from a government plan.
So how does that get us better health care?
Well, you can't require better health care if you don't have doctors. It doesn't matter what your insurance.
Exactly.
So I just think this is something that the federal government cannot micromanage. We need to encourage more doctors. We need to encourage people to have insurance, but we can't run health care.
All right, let me ask you this, Senator. What can I do? And when I say what can I do, what can I and my listeners do to put the brakes on this thing, to cut out the legs from underneath it?
Well, we can't relax. I mean, we've had several months of people being engaged, and I think they're just getting tired and fatigued with dealing with this health care issue, and I think the President is counting on that. The next few weeks are key. We've got to melt the phones, as we say, for particularly the Democrats and some of the Republicans who might be not sure of what they're going to do. People need to stay engaged for the next few weeks with emails and phone calls. Visit their senators' offices back home in the state, any state. And it doesn't matter if it's a Republican or Democrat. Every one of us needs to know that their people back home do not want government-run health care.
All right. Well, I'm going to keep holding up my end of the deal on this one, and then see if we can get lucky. It's up to you and people like you, Senator, to make it happen. Well, make it not happen.
Well, John, the pressure, the power comes from the outside. And so the more you get out the word, the better it is. And we wouldn't have stopped it so far if it weren't for folks like you on the air.